Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Pramita Esha Nirmala Dewi. I'm a lecturer at Faculty of Medicine and Health Sciences Universitas Muhammadiyah Yogyakarta. And today I would like to present my report related to my social activity entitled Integrated Impact of Community Health Worker Training on Cardiovascular Risk Awareness, Physical Health and Mental Well-Being, a pre-post intervention study in rural Indonesia. This was a collaborative community-based study conducted in rural Indonesia under the Interprofessional Collaboration Community Service Scheme. And let me walk you through our journey and findings. Cardiovascular disease remains one of the leading causes of death in Indonesia, especially in underserved rural communities. In Nogotirto village, we identified that nearly 40% of adults visiting Pospindu had hypertension. Recognizing the lack of access and disruption from the pandemic, we focus on empowering local Pospindu cadres. The study aimed to assess whether training these cadres could improve not only physical and cardiovascular health literacy, but also mental well-being. We employed one group pre-post quasi-experimental design in Nokotirto village. A total of 91 participants were involved in different aspects of the study. Our intervention included training local Pospindu cadres on cardiovascular risk detection, physical screening, and basic mental health assessment using the PHQ-9 tool. We evaluated outcomes through physical exam, knowledge test, and mental health questionnaire before and after the intervention. Statistical analysis was conducted using SPSS. Our findings revealed a significant improvement in physical health. Most participants were middle-aged, with a predominant background as housewives and informal workers, group that often associated with limited health access. Importantly, we observed statistically significant reductions in both BMI and waist circumference after the intervention. This shows that the cadre-led community action had a real impact in mitigating obesity-related cardiovascular risk. On the knowledge front, we observe a substantial increase in post-test scores, suggesting that the cadre-led educational efforts were effective. Statistically, the improvement was highly significant. Regarding mental health, most participants reported minimal depressive symptoms and none had severe depression. While changes in mental health were modest, the integration of PHQ-9 screenings provided valuable insight into the community's psychological state. In conclusion, our study highlights the feasibility and effectiveness of empowering community health workers to deliver holistic intervention. The program led to measurable improvement in physical health and cardiovascular knowledge. Although the effect on mental health was less pronounced, incorporating psychosocial components contributed to a more comprehensive health approach. For future efforts, longer term and more structured intervention are recommended. This slide features documentation from our community activities. The photos reflect active participation from both the cadres and local residents. They show the enthusiasm and commitment that made this program a success. Thank you for your attention. We hope this initiative can inspire similar models of community empowerment in rural healthcare. I would be happy to take any question from you. Thank you. Assalamualaikum warahmatullahi wabarakatuh.